This presentation is called What Can Data Do for You 2.0? With a focus on Syringe Services Programs. The presentation was designed for participants of the collaborative Syringe Services Programs Institute, hosted by NASTAD, New York City Capacity Building Assistance, and AIDS United, and it is a 2.0 in order to reflect increased skills with data collection and evaluation in this community. The 2.0 focuses on barriers to data evaluation and encourages participants to consider creative and collaborative strategies. We gave this presentation in Nashville, Tennessee on February 14th. I am Lauren Maria Fuller. I'm the Syringe Access Policy Organizer at AIDS United. AIDS United is a national organization dedicated to ending the HIV epidemic through capacity building, grant-making, and policy advocacy. Get to know your participants. This is an opportunity for participants to introduce themselves. Ask that they tell the group their name and pronouns, the role they play at their organization, and answers to the following questions. How long have you been doing harm reduction work, and what do you hope to get from this session? Thank participants for their feedback and reflect on what they're hoping to learn. The learning objectives for What Can Data Do for You include understand best practices for data collection and evaluation processes for Syringe Services Programs, identify specific ways data can be used to strengthen SSP program development and partnership, and develop strategies to address barriers to SSP data collection and evaluation. Successfully addressing comprehensive drug user health and HIV prevention involves a range of services and interventions. By definition, this means that different agencies, health and social services providers, health professionals, and others active in the community must work together to plan, carry out, manage, and monitor these efforts. This session aims to assist people working in SSPs, community-based organizations, and other entities to collaborate with partnering organizations in data collection and evaluation in ways that keep their services low barrier while still providing helpful information to improve program efficacy. Attendees will use what they've learned about participant-informed data collection to identify how data and evaluation can improve service delivery and strengthen community partnerships. Now, on to reviewing Data 1.0. What data are you already collecting? Some common answers include the number of participants who come to the Syringe Services Program, the number of people who received hepatitis C and HIV tests, the number and type of supplies distributed, and participant feedback about the program. The facilitator will ask the room who is already implementing Syringe Services Programs and record the responses on the flip chart paper. The questions they'll ask include, what data are you already collecting? How do you track the work you do? What constraints do you face in collecting data? Is there a string attached to funding? And how do you involve participants in this conversation? It is crucial that a Syringe Services Program establish a clear monitoring and evaluation plan from the start and integrate this into their work plan. The common data indicators that Syringe Services Programs collect related to the main function of their program are the number of participants, demographic information about participants, including age, race, ethnicity, education, gender, etc., the number of repeat and unique participants who use the Syringe Services Program, an increase in number of participants over time, the number of naloxone doses distributed, the number of other materials distributed, the number of overdose prevention training facilitated, asking where and from whom participants feel comfortable getting supplies, and participant satisfaction with programs, including hours, locations, and staff interaction. The minimum data indicators that all SSPs should be collecting include the number of participant contacts, the number of syringes distributed, and the estimated number of syringes returned for disposal. So, why evaluate? Why do you evaluate your program? Who performs the evaluation? When and how often do you evaluate your program? In this 2.0 about data, we're going to focus on what we're doing with the data we collect, because as Syringe Services expanded to new regions and existing programs become more sophisticated, there are greater challenges around data for us to consider. Data has no inherent value without thoughtful and active analysis. Therefore, programs should actually look at and utilize the data they are collecting. They should use the data to identify gaps and strengthen programming, and they should evaluate whether the program meets participants' needs and satisfaction, the program offers the services requested by participants, the program is meeting their deliverables as stated in funder, partner, and regulator agreements. Syringe Services Programs should watch for trends and increases in HIV and or viral hepatitis among their participants, increases in overdose among their participants, changes in local substance use trends, changes in risk behavior among their participants, types of services used at the Syringe Services Program, the frequency and duration of program use, including estimating the number of syringes distributed in a given period, receptive and distributive syringe sharing among participants, what their disposal practices are, how are they accessing and linking to drug treatment and medical and social services, and what are their drug use preferences, what types of drugs are used, including hormones and steroids, and what practices is used to inject them. Then you can try to estimate the number of users reached through secondary exchange and estimate changes in drug use, injection, and treatment as a result of participation in the program. Now, these are a lot of different questions to consider, but here are the key considerations to take away from this review. The effectiveness of Syringe Services Programs has already been established through scientific evaluations. Therefore, the main goal of evaluating local Syringe Services Programs is to assess whether a program is operating in conformity to its design, reaching its specific target population, and achieving anticipated implementation goals. In general, outcome monitoring methods should aim to minimize participant burden, not disrupt normal program activities, and only collect information that is critical for understanding process outcomes. Consider a phased approach. You don't always have to get data on a first visit. Data is personal, particularly about drug of choice and number of past overdoses. Build trust over time, and eventually participants may feel comfortable opening up. Be aware of how you are asking some of your intake questions. Be aware of tone, body language, and your own biases. Understand that certain questions may be harder for participants to answer than others. Explain why you are collecting data to your participants. You can start a conversation with, quote, "I am required to ask this, but you don't have to answer," end quote. You can trust your participants to understand the reasoning behind the questions you ask. Most importantly, a person's refusal to answer data-related and intake questions should never prevent them from accessing services. Nothing should ever prevent a person from leaving without services. Now, not all of the data is your responsibility to collect. Syringe Services Programs can utilize existing resources for partnership development, client-level engagement, and advocacy. Syringe Services Programs are often asked to make the case for harm reduction to the communities in which they are situated. Here are two real-life examples that demonstrate the value added of SSP data collection. Staff from 3 area Syringe Services Programs made an appointment to meet with the region's mental health services coordinator about improving referrals to substance use treatment through their program. The viral hepatitis coordinator in their region helps them identify who to meet with and helps them create a one-page information sheet about their programs and their role in addressing overdose and infectious disease. When the staff members met with the mental health services coordinator, they had an important tool to introduce and contextualize their work. The coordinator appreciated the one-pager so much that she asked the staff of the Syringe Services Programs to send her a digital copy that she could share with her peers in other parts of the state. In this other example, a group of HIV Services Program staff and their clients visited Washington, D.C. for an advocacy day, and they wanted to discuss the need for additional funding to support Syringe Services Programs. They brought informational material from the AIDS View website that were specific to the Congress member's district. The website allowed them to print a one-page document that included a map of the district that highlights counties vulnerable to HIV or hepatitis C outbreaks due to injection drug use and rates of drug-related overdose, as well as infographics representing infectious disease rates and information about health insurance coverage and substance use treatment resources. Let's take a look at the existing resources that you can utilize in the process of developing strategic partnerships. When applying for funding, as part of advocacy efforts, and when engaging clients and community members about the work you do and the public health issues that you're addressing. CDC's Atlas Plus. The National Center for HIV/AIDS, Viral Hepatitis, STD, and TB Prevention built a website that makes it possible to view data on HIV, viral hepatitis, sexually transmitted infections, TB, and social determinants of health in charts and in maps. You can download state health profiles and slide sets of common queries from the site. AIDSView and HepView are interactive online resources that visualize the impact of HIV and hepatitis across the U.S. from the Rollins School of Public Health at Emory University in partnership with Gilead Sciences. It's possible to download and print customizable fact sheets based on your area. The most targeted online resource for Syringe Services Programs is the AMFAR Opioid and Health Indicators Database. AMFAR collects local and national level data on indicators related to opioids, HIV, hepatitis, services, and policy, and it's easy to print out a fact sheet on your own state or local district. When looking for longitudinal data about Syringe Access Program, look no further than the National Dave Purchase Memorial Syringe Exchange Survey, a collaboration between Beth Israel Medical Center and the North American Syringe Exchange Network. View recent findings on NASTAD's website, although it's currently under construction, and as a Syringe Services Program, participate in the annual survey for the unique opportunity to contribute to this important body of research. Finally, SAMHSA conducts a national survey on drug use and health every year. Visit the data archive to explore past data reports at pdas.samhsa.gov. Some limitations with this data are that it excludes people who are incarcerated and people who are health and vulnerable because the survey is conducted within households. For some data, you may want to tap into local and regional resources. Check out your state's most recent report. After the 2015 HIV outbreak in Scott County, Indiana, an assessment of all U.S. counties was conducted to look for similar indications that an HIV outbreak could occur among communities of injection drug users. Since that vulnerability assessment was conducted, specific areas of the U.S. have received extra funding to conduct further vulnerability assessments. In particular, if your state has applied for a determination of need from the CDC, you can request a copy to see what data the state used to describe your area's drug use and infectious disease landscape. You can ask your jurisdictional point of contact for more information on cdc.gov/HIV/risks/SSPs-jurisdiction. Viral hepatitis programs do not benefit from the same level of infrastructure for surveillance that HIV programs have. If you're having trouble finding reports on the impact of viral hepatitis in your area, then contact your region's viral hepatitis prevention point of contact, which can be found on the CDC's website. Since 2003, the CDC has conducted cycles of surveillance among people who inject drugs in 22 metropolitan areas of the U.S. The National HIV Behavioral Surveillance may be conducted in your area. While findings are published in reports and scientific publications, you may also request a report on specific data indicators from the project coordinator in your area. Okay, now let's consider in this brief overview are the tools that help Syringe Services Programs have a clear framework of where and how they are collecting data. Intake forms, service logs, participant feedback, and program information are the key areas where you can access critical information about the people you serve and how the program is operating. You can ask for information at the beginning of your relationship with a participant through intake forms, during service hours through service logs, and after participants have received services with participant feedback tools. At certain times of the month or year, you may report program information to funders or regulatory agencies, and you may evaluate your program every year or 2 years. Here are some tools you can reference for data collection and evaluation. Intake forms. Intake is a key area where you can access critical information about the people you serve. But remember, the data collection does happen throughout the lifetime of a Syringe Services program. Some of the information on an intake form can be followed up with participants in subsequent visits. So here are some examples. First name only identifies the individual as participant, which may protect them from law enforcement. Initials, an alternative to getting a participant's first name. Birth year, which will describe the age of your service population. Zip code, which describes the program's reach and identifies geographic areas where there are gaps. Sex or gender, again describing your service population, as well as sexual orientation, race or ethnicity. You can also ask preferred language to tailor program services to participant needs. You can ask about injection frequency in order to estimate syringe needs for a needs-based distribution model, and drug preferences to evaluate program services and tailor them to specific participant needs. Medical home to identify access points for medical care for program planning and referral. Access to other services. Identify needed medical, substance use, and mental health services for program planning, referrals, and quality improvement. Again, with those key considerations about collecting data at intake, consider that phased approach, building trust, and eventually participants might open up to you. Being aware of how you're asking your intake questions and consistently working to undo drug-related stigma. Always explaining why you're collecting data and trusting participants to understand the reasoning behind the questions you ask. And, of course, most importantly, a person's refusal to answer data-related intake questions should never prevent them from accessing services. Next, the service log. Service logs can capture critical information about supply inventory as well as what supplies participants tend to use. Participant coding. When you're running a Syringe Services program, you may not always have time to document extensively. Coding is a shorthand way to get the information you need to recorded in a matter of a second. You can do participant ID, city, county, gender, race, ethnicity, exchange type, and then what supplies do you use? Think about what your participants ask for and what doesn't get asked for. This also helps keep you on track when you're running low and when you need to report. Use this sample rapid feedback card, which was adapted from the University of Wisconsin, can be a quick way to get feedback on your programs and services. You can ask where and from whom participants feel comfortable getting their supplies. You can ask for participant satisfaction with your program, including hours, locations, and staff interaction. You can evaluate whether your program is meeting participant needs and satisfaction by collecting this feedback. While these feedback cards can be easily handed out and collected during services, Other options include participant or community advisory boards, key informant interviews, focus groups to assess participant satisfaction with program elements, and learning how Syringe Services Program participants use the services and how new services might be received. There is also another form of data that is usually required by federal and local funders called aggregate data. This data is often quantitative. It usually encompasses data that is not directly related to the main function of your program, but serves to enrich or enhance the outcomes of your program. This may include the number of client referrals, people reached through social media, interventions offered to the community, public events conducted, referrals to mental health and substance use services, the number of condoms you've distributed, the number of HIV or hepatitis tests you've given, and the number of Medicaid referrals. A really important one to point out is you can report on experiences of stigma, which can be measured using police data and lessons from STRIVE, a UK system that aims to create a standard for assessing HIV-related stigma. And among sex workers who use drugs, you can measure using bad date sheets, and you can ask about experiences with law enforcement. This is a time that you can ask participants, what is realistic for syringe services programs in the communities you serve? Opportunities for evaluation. Evaluating a program allows you to be able to answer the question, are we doing what we said we would do? Did we do what we said we would do? Are we meeting and did we meet the goal? Are participants satisfied? You can access critical information through surveys, focus groups, interviews, or just observation and documentation. This sample evaluation approach worksheet begins with your evaluation question. What do you want to know about the program? Then it identifies the data indicators needed to address that question, and it asks, where will you collect this information from? What will your data source be? Frequency is a key component to this worksheet. How often do you plan on conducting evaluation? Every 3 months, 6 months, year? Then it asks you to identify who is responsible for addressing the evaluation question. The final outstanding needs section is a great place to consider for community-based organizations, health departments, and other groups who might need capacity building assistance might be able to get some assistance. Now that we have reviewed what opportunities Syringe Services Programs have to collect and evaluate data, we can break into groups to address the challenges that Syringe Services Programs face. Some of these barriers may be internal or factors from within the program, and other barriers may be related to external forces, like scarcity of resources. Have participants identify barriers that prevent them from collecting and evaluating data both internally and externally. This is framed as a learning exchange between folks who are already doing the work and those who might not be. The goal here is to understand what are the minimum lowest barrier data to collect and what resources are necessary to achieve that. In the second half of the activity, participants use the barriers mentioned and strategize how they would face them in collecting and evaluating their data. They are welcome to share peer-to-peer lessons learned if they have overcome this barrier in the past. So, in small groups, participants should discuss an evaluation question of their own choosing. They should consider question 1, what are the minimum data indicators you want to explore? Question 2, what are the internal barriers that impact your ability to collect this data? Internal barriers may include staff capacity, keeping services low barrier, etc. Question 3, what external barriers impact your ability to collect this data? These might include negative community reactions, privacy concerns, etc. Within their groups, participants should discuss, and one member of the group should be instructed to write their responses down on Post-its or on 3 separate pieces of paper at their respective table. Examples of barriers may include, where does the data really go? Mobile and street outreach capacity, fears of arrest or police violence against program staff, staff or agency capacity, working in mobile and rural settings, political climate, lack of experience, gaps in technical knowledge, and inefficient monitoring and evaluation practices. After all the groups have had adequate time to record their answers to the 3 questions, pick up their responses and swap their responses with another group. In the second half of the activity, the small groups will now have another group's responses to the activity. What are the minimum data indicators you want to explore? What are the internal barriers? And what are the external barriers? Now they'll be tasked with coming up with data collection strategies to overcome these barriers. The question they should answer is, what do you need to overcome this barrier? Remind participants that data can take many different forms, and the solutions to overcoming barriers to data collection can take many forms also. Request that they be creative, innovative, and think outside the box. Debrief the activity with the whole group. What solutions did they come up with? These may include develop collaborations between community partners and stakeholders, use existing local and national databases, adapt or create strategies and tools that are realistic and fit your approach and community, and address ethical concerns. Stakeholders can help assess the, quote, appropriateness and feasibility of your evaluation questions, offer insight on methods to access the target population, provide ongoing feedback and recommendations, and help make evaluation results actionable. That's the benefit of working with community partners and stakeholders. When using existing local and national databases, indicators that are more directly associated with drug injection, like treatment admissions, arrests for drug injection paraphernalia, etc., could be prioritized, and indicators of more upstream events potentially leading to drug injection, like prescribing and dispensing practices, can be examined as additional supporting evidence. Syringe Services Programs often work in non-clinical settings, including mobile settings. Intake forms that can capture participant data may not be realistic or confidential in these settings. In thinking about how you can collect and evaluate data, consider the space you are working in and the time you have available. You may also have concerns that collecting data may go against your low barrier approach to services. Some programs may consider their frontline service workers or volunteers to be restricted in their ability to collect data for evaluation because of the risk to the quality of their relationship with the participants and the potential for serious breaches of participant confidentiality. For programs that are small and do not believe they could fund dedicated staff to focus on data collection and evaluation or fund formal evaluations of their work, partnerships with researchers is a possible solution. The researcher Don Desjardins noted in a 2017 article, quote, the 2 basic components of harm reduction are pragmatism, providing policies and services that are effective, and respect for the human rights of persons who use drugs. The 2 basic components of research on harm reduction are measuring the harm that can be reduced through improved policies and new programs, and conducting ethical research with persons who use drugs. Ethical research with human subjects involves 1, benevolence. The research should benefit the persons who participated as subjects. 2, autonomy. The participants should have the right to determine what activities they will and will not participate in. And 3, justice. The research should benefit not just the individual participants, but also the community of the persons who participated. Now, this is a great time to foster discussion with participants in this What Can Data Do For You presentation. And once discussion has quieted down, you can do a closer look at partnerships. Syringe Services Programs can benefit from developing partnerships with various entities to support data and evaluation efforts. When developing partnerships, assess stakeholders in your community. Assess the characteristics of local communities and current modes of access to services. Identify key stakeholders and assess their knowledge and attitudes towards Syringe Services Programs. and consider what skills and resources are available for Syringe Services monitoring and evaluation. Assess stakeholders in your community who may have the skills and resources to help with program monitoring and evaluation. Often universities, health departments, and other services providers may have the kind of skilled staff needed. Conducting a good evaluation requires skilled staff that are dedicated to the task. Evaluators do not need to necessarily be university-affiliated scholars, but should understand the premise and execution of basic research design. Cooperation between program staff and evaluators will improve the quality and relevance of outcome evaluation. When working with other programs, it is important to plan ahead with the goals of the collaboration. What organization is responsible for what activity, and what activity should be monitored in order to evaluate how the collaboration is working out. We want to establish common goals and evaluation questions. People who use drugs, staff, and volunteers of the program, and other stakeholders should be meaningfully involved in defining the purpose of the collaboration. Develop applied methodology. Is there a management information system, database, established for ease of shared data collection and analysis? Some programs must use mandatory data collection and reporting systems determined by their state or local health departments, while others may have used the REDCap system through research partners or their own spreadsheet. What is the relationship between those who collect, enter, and provide data reports and those who analyze the findings emerging from the data? Establish regular communication and collaborative relationships. To ensure necessary buy-in to the evaluation from stakeholders, particularly the staff delivering services, regular communication mechanisms and processes should be established among those involved. Regular communication should include open discussions of issues and problems that need to be addressed, and collaborative problem solving about how best to respond. Regular feedback mechanisms should be established to provide ongoing updates on the evaluation and delivery of services to all stakeholders. An important focus of these updates should be guidance on the application and utilization of data throughout the course of the evaluation that informs service delivery. In many cases, stakeholders will need to be prepared to make adjustments in both the evaluation methodology and the service delivery based on issues that arise during the evaluation. Can you automatically enter data on a mobile device, or will you use paper and spend time entering the information into a computer-based spreadsheet? What is its ability to generate reports? Those are some examples of questions that might require adjustment. So, by collaborating with universities, Syringe Services Programs may be able to host internships and volunteer opportunities while students and professors can contribute to research design, implementation, and analysis. At one Syringe Services program, the manager has written, to further our efforts to build a program based on evidence, research, and data, we enlisted the help of a state university through a community partners relationship. Even though we are an organization of academics, healthcare professionals, treatment providers, and harm reduction experts, we know that it is important to garner help from outside entities to ensure policies are created without uninformed bias. Since beginning our partnership with the state university, we have engaged and utilized the efforts and skills of students within the bachelor's and master's programs, both in sociology, criminology, and social work. Our organization, consumers, and community have benefited greatly from this partnership. Our relationship with the state university has grown exponentially. We started with 1 intern per semester, and now we're hosting at least 2 interns and 5 volunteers each semester. This semester's current partnership is the most robust one yet. We have a group of about 50 students working in 4 different groups that are creating and implementing different projects. We distribute a yearly consumer survey and utilize the sociology department at the state university for its design, implementation, and analysis. We make the results of the surveys available on our website. Other community-based organizations. You may be an HIV organization that wants to address harm reduction with another agency that works in mental health or housing or something else. Your Syringe Services Program could provide harm reduction training for a partner agency. A partnership may enhance access to syringe services, increasing hours and locations of access. You can work together to manage public relations, which may help increase community support for syringe services. Additional operational and human resource costs may be offset if the partner organization already has the requisite systems and expertise. In Kentucky, where new syringe services programs are expanding rapidly, among harm reduction programs the state recommends are, quote, collaboration or satellite structure models, end quote, which existing syringe services programs provide syringe services at partner social service agencies in fixed sites in the community, for example, at a homeless shelter or in a mobile van. It requires that the syringe service program provide capacity building training for the partner agency. The strengths of collaboration or satellite structures include the following. Access to services may be enhanced through additional locations and expanded operating hours. The existing participant base can help advertise the availability of syringe services with their peers. The parent program may have experience managing public relations, which may help increase community support, and more. Potential limitations of collaboration include it may be challenging to keep track of inventory if specific systems for doing so are not in place. If the parent organization and satellite site may have different policies or procedures, could lead to inconsistencies or discord among participants. With boosted federal funding for SAMHSA, there are new opportunities for collaboration with governmental entities. Health departments and human services districts can collaborate to meet the goals of the Opioid State Targeted Response Grants and Programs. Naloxone programs can unite your area's recovery services and syringe services programs with support groups and counseling services. And these blended services are key. Housing, harm reduction, medication-assisted treatment, and substance use treatment support groups and counseling altogether may increase access and availability in your region. Local and state governmental entities like public health departments and behavioral health services are tasked with coordinating programs involved in the surveillance, prevention, and response to overdose and infectious disease crises related to drug use. While public funding for syringe services programs varies widely from state to state, there are opportunities at public health departments and behavioral health services to collaborate with syringe services programs on certain program components. For example, the Missouri Department of Mental Health launched the Opioid State Targeted Response Project after receiving a $20 million federal grant. Through its partnership, particularly with a local syringe services program, it has helped provide treatment for nearly 3,000 people over 2017 and distributed 6,000 overdose reversal kits with naloxone and the accompanying training on how to use them to save lives. The grant team is housed at the University of Missouri in St. Louis and is a grant-funded research institute of the university administering and evaluating federal and state programs to improve health and well-being. Led by Rachel Winograd, an assistant professor of research, Winograd directs the partnership between the Missouri Department of Mental Health and the Missouri Network for Opiate Reform and Recovery, a harm reduction organization and syringe services program whose community centers open 7 days a week and, in addition to offering syringe services, host support groups and legal and health services. Now that we've considered these various kinds of collaboration, let's work through the realities of data collection and evaluation in the syringe services program context using this scenario. You've been running a fixed site exchange in the Ohio River Valley for the last 3 years. You are reporting on how many unique individuals you reach every month, as well as the number and type of referrals to treatment and services you have offered. You want to keep your syringe services programs as low barrier as possible, but also want to demonstrate the impact on your community. Ask participants to split into groups to complete the program evaluation approach worksheet, first as a standalone syringe services program, and then address the evaluation question, the same one, as a program with a partner organization. This gives us the opportunity to imagine what's different. What are the pros and cons of partnership post-activity? Consider, what impact are you having on your community? What data indicators are you evaluating? Where will you collect this data information from? How often will you collect and evaluate? Who is responsible for addressing this evaluation question? And what additional support do you need? Let's go through an example. When working in collaboration with a behavioral health service provider, we can ask, are participants satisfied with access and linkage to drug treatment? For indicators, we're evaluating the quality of referrals to drug treatment. If available, the number of referrals made in comparison to the number of participants who actually entered drug treatment. The data source. We can look at intake forms if they ask about interest in drug treatment, service logs if they indicate the number of referrals made, and we'll need to convene a focus group or ask for participant feedback to determine participant satisfaction. How often do we make this evaluation? In the past, we may have only evaluated this question at most once per year because the options for drug treatment were usually stagnant and we don't renegotiate memorandum of understanding with partnership organizations very often. However, as SAMHSA is dispersing additional monies for medication-assisted treatment, we may want to start evaluating this more often. More and more treatment facilities are opening. So who is responsible for this evaluation? Syringe Services Programs face barriers to accessing information about treatment intake and outcomes on their own. We may have a partnership with a local service provider or a collaborative agreement with our local alcohol and drug prevention organization. Or we may be evaluating this based on our own limited internal resources. Do we identify a staff member who performs the evaluation in a collaborative agreement at our program, or do we have an outside researcher? The Outstanding Needs section may identify ways to build capacity at our Syringe Services Program. Would it help for Syringe Services Program staff members to go with a participant to drug treatment for the intake process to advocate on their behalf? Do we need to build stronger community partnerships with drug treatment programs? Maybe we do not know how to address a lack of participant satisfaction with drug treatment referrals, and we can ask for help. Consider that capacity building assistance is available to you. So you can wrap up the group activity with report backs from small groups. So why do we collect data and evaluate our data? For reporting out to community members and stakeholders, for grant reports and advocacy purposes. For evaluation findings to make a difference, the written reports must be of high quality. A useful evaluation report will provide contextual information to put the evaluation findings in perspective, present persuasive evidence that is strong and relevant, and include specific, realistic recommendations for policymakers and program planners that will achieve results. Now, you can ask participants for feedback on this and record it on a flip chart paper. Ask, what existing databases and tools will you use in your activity? What did you take away from this session about how you track the work you do? And how do you hope to involve new partnerships in your program data, evaluation, and operation? This is a summary slide to sum up the strategies that participants have developed throughout the training. We discussed opportunities at Syringe Services Programs to collect information about the people reached and how the program is operating through intake forms, service logs, participant feedback, program information, and program evaluation. We explored the collaborative relationships we can build with researchers, students, behavioral health systems, and community partners to strengthen our data collection, evaluation, and program operation. We also looked at the existing databases of information that help us make our case to partners, legislators, and community. These activities help us center the knowledge of SSP program participants in data collection and evaluation efforts. These resources exist for participants to begin developing and strengthening data collection strategies for the Syringe Services Programs Institute. Please share data collection and evaluation tools that you've used in your work with your colleagues and share your other lessons learned. As we say goodbye, I just want to remind you that AIDS United works with community-based organizations, Syringe Services Programs, and their partners to address the HIV prevention needs of people living with and affected by HIV. Our capacity building program supports program startup and implementation, human resources development, strategic planning and sustainability, and more. To learn more about our program, email siba@aidsunited.org. Thank you so much for attending.
Thank you. Please stand by.